In this video by Deckplate, we will understand the VA disability ratings for intestinal surgery, bowel resection, colostomy, and ileostomy. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA provides disability ratings for various intestinal surgeries depending on the severity of symptoms and the resulting impact on the veteran's health. Resection of the large intestine, bowel resection. Diagnostic code 7329. 100% rating, total colectomy with formation of an ileostomy, high output syndrome, and more than 2 episodes of dehydration requiring intravenous hydration in the past 12 months. 60% rating, total colectomy with or without permanent colostomy or ileostomy, without high output syndrome. 40% rating, partial colectomy with permanent colostomy or ileostomy, without high output syndrome. 20% rating, partial colectomy with reanastomosis, reconnection of the intestinal tube, with loss of the ileocecal valve, and recurrent episodes of diarrhea, more than 3 times per day. 10% rating, partial colectomy with reanastomosis, reconnection of the intestinal tube. Rectum and anus, impairment of sphincter control. Diagnostic code 7332. 100% rating, complete loss of sphincter control characterized by incontinence or retention, not responsive to a physician-prescribed bowel program, requiring surgery, digital stimulation, medication beyond laxatives. Special diet, or incontinence, 2 or more times per day, requiring changing a pad 2 or more times daily. 60% rating, complete or partial loss of sphincter control with incontinence or retention partially responsive to treatment, requiring surgery, digital stimulation, medication, special diet. Or incontinence 2 or more times per week, requiring a pad 2 or more times weekly. 30% rating, complete or partial loss of sphincter control responsive to treatment with medication or diet, or incontinence 2 or more times per month, requiring a pad 2 or more times per month. 10% rating, complete or partial loss of sphincter control responsive to treatment, with incontinence at least once every 6 months, requiring a pad at least once every 6 months. 0% rating, history of loss of sphincter control, currently asymptomatic. Note: complete or partial loss of sphincter control refers to the inability to retain or expel stool at the appropriate time and place. Rectum and anus stricture. Diagnostic code 7333. 100% rating, inability to open the anus, with inability to expel solid feces. 60% rating, reduction of the lumen by 50% or more, with pain and straining during defecation. 30% rating, reduction of the lumen by less than 50%, with straining during defecation. 10% rating, luminal narrowing managed by dietary intervention, with or without straining. Conditions such as dysenergic defecation, levator ani, and anismus, functional constipation, are also rated under this code. An ostomy is evaluated under diagnostic code 7329 for the large intestine resection. Thank you for watching this video. Please don't forget to subscribe and like our videos.